It's my pleasure to welcome the next presenter, who's come to us all the way from Ireland. And this is Dr. Noel Richardson, and he's lecturer and director, Centre for Men's Health, Institute of Technology in Carlow, Ireland. And his talk is about men's health and a wellbeing program that he's been involved with.
Well, good afternoon, everybody. I'm delighted to be here and to share some of the work I've been involved in Ireland. This is a very different kind of program, a very different kind of project, and it's still underway in terms of the evaluation that I'm involved in. So I'm kind of more interested in speaking about the challenges involved in working with the target group, which I'll say more about in a second. That's the first thing. And also the challenge of partnership between a community development organisation who's running the programme and other key stakeholders in the community. And I'll say a little bit as well about the evaluation tools we've used, which are ongoing, and some of the lessons learned from that. So just to give you a brief background, first of all, this is an existing programme that's running in Dublin's inner city, northern inner city. It's targeting a very disadvantaged group of men. It's mostly unemployed men with a history of substance misuse, drug addictions, and so it's often, I suppose, described as a hard to reach group of men, which very often don't reach programs or don't succeed in accessing services. So my role and our role in the Centre for Men's Health, where I work in Carlow, was to assist with an evaluation of the programme. And this is something that's flagged in our national men's health policy, is the need for more support for service providers who are delivering programmes, say in community organisations, who have skills to provide programmes but don't necessarily have the skills to evaluate what they're doing. So our objective was to provide that support and also to provide fairly accessible findings and recommendations that could have implications for transfer to other community sectors. I won't go into the details here, but it's well documented that poorer men have poorer health. So we often talk about differences, say, in life expectancy between men and women, or higher rates of mortality among men compared to women. But when we actually delve under that a little bit, we find there are actually a lot more significant differences between populations of men rather than just between men and women. So there's a really strong mandate in terms of all of the health stats for poorer men. In Ireland, certainly, I'm sure it's the same in Canada or Australia or anywhere else, there's a lot of talk about joined up thinking and more intersectoral work to target issues like marginalisation, discrimination, social inclusion and education. And that's certainly something that's named in our national men's health policy. The policy also talks about the need for a social determinants community development approach. And again, I would reiterate there's a lot of talk about those kind of approaches, but there aren't that many examples of it working well in practice, and I'd like to think that the programme I'll talk about is an example of that working well. So, as I mentioned, the programme is provided by the Larkin Centre. It's a community development organisation based in Dublin's inner city. It provides a range of programmes and resources and services for disadvantaged groups within that community. And the manager within that programme was conscious over a number of years that it was mostly women that were accessing the programmes and services that were provided by the Larkin Centre. So she was responsible for coming up with this men's health and wellbeing programme. The programme comprised a mixture of health screenings, health awareness or health education elements, cookery classes and soccer fitness training. And as I mentioned earlier, it's a partnership programme between the Health Services Executive in Ireland, Celtic Football Club, Pfizer Pharmaceutical Company, and it runs for 4 hours per week over 10 weeks. I haven't listed all the objectives of the programme, but I just mentioned these three in particular as being quite pertinent. The first is about enablement, I suppose, and empowerment of participants to take positive changes in their own lives and to take control over their own health and well-being. So it's trying to provide participants with skills and competencies that they could take away from the programme and live better and healthier lives. The second objective that's worth noting, I think, is the development of appropriate and gender-sensitive learning strategies and materials reflecting a learner-centred style of working. Very often services tend to say, well, services are there, participants can use them, or take them or leave them, but really we need to think about how men and women might want to access programs differently, or what they might like or what they might need in services. And the last one was to create a context that locates learning as part of community life and that builds capacity in the local community. So it was about building capacity within the local community so that there would be a sustainable impact after the program was finished. So in terms of methodology, there's kind of two main phases to that. Well, three if you include the kind of final synthesis of the first two phases. The first has been completed. That was an initial, fairly simple, basic evaluation that was done, which comprised a literature review, an analysis of some baseline and follow-up health and fitness data. So there was measures, say, of blood pressure, cholesterol, waist circumference measurements, body mass index, and some basic fitness scores as well, say, for cardiovascular endurance. Participant observation, I had a master's student whose assignment was to go and sit in on some of the programs, get a feel and get a sense for how the program was going. And the last part of the phase one was focus groups with participants and key stakeholders. So there were two focus groups with two groups of participants in the program and one with key stakeholders. In other words, the Pfizer, the Health Service Executive, the Larkin Centre itself, and representatives from Celtic Football Club. The second phase of the methodology is now begun and it's ongoing. What we've done is we've tried to target all participants who've gone through the program, and we've developed a questionnaire to look at measurements like general health, lifestyle behaviours, self-esteem, self-efficacy, mental health, quality of life and social capital. And this has been administered face-to-face by the researcher, by a master's student. So 96 men were recruited for that out of a total of about 120 who've passed through the programme, and a matched control group from the local community. There were 71 in that. The second phase, which is about to begin, is a series of in-depth interviews with past participants examining the impact of the programme at kind of three main levels. One is on the individual, so how it's impacted in terms of self-confidence, self-esteem and on health. Secondly, on family, has it impacted on relationships and men's involvement in family life? And thirdly, it's on how the programme has impacted in terms of how the individual participants interact with their local community in terms of involvement and connectedness with the community. And the third phase will be a kind of triangulation or a synthesis of those key findings. Okay, so just a brief summary of some of the results to date. There was fairly strong improvements in the health and fitness profiles of program participants. So cholesterol levels reduced, blood pressure, there's some reductions in blood pressure, aerobic fitness levels improved, and some modest reductions in body weight and waist circumference measurements. And these are all in the actual evaluation. I won't go into it in a short time today. The focus group data highlighted that participants had experienced significant gains, not just in feeling healthier, but in terms of self-confidence, self-esteem, and overall well-being. And the third thing I think which was really interesting from phase one was the high level of adherence and engagement with the programme. And participants identified these kind of 5 or 6 key elements that they found, that was their experience of the programme. The first was about camaraderie and fun. This is something that my student who sat in the programme felt really strongly about, that they just had a great spirit and sense of community and group camaraderie within the programme. The sense of mutual respect and trust that was developed over the 10 weeks. So a lot of the men would have had poor experiences of services before this. So this was a different kind of experience. They felt the programme providers respected them as men and as participants in the programme, which wasn't necessarily their experience before. Allied to that was a positive, non-judgmental approach of staff. The fact that services were brought into the men's community, so they didn't have to go to the doctor. The health screenings were done on site. Some men were referred for further consultations to the doctors. And the activity and cookery classes were all done within the community. They found it a safe space to go. They were comfortable there. They didn't feel threatened. They didn't feel ill at ease. And the last point was really important, which was the ethos, leadership and commitment that permeated across all aspects of the programme. So it's really strong follow-up by the service providers. If somebody missed a session, they got a phone call. Really strong connection and rapport and communication between the service providers and the men themselves. So in terms of next steps, we're currently analysing the questionnaire, which will provide much more in-depth data on the longer-term impact of the programme. The in-depth interviews are about to start, and as I said, then we're going to try and triangulate that data to come up with sort of effective practice guidelines so that the programme could possibly be transferred to other areas in Ireland or indeed elsewhere. And we're thinking about different strategies for dissemination, in terms of, say, booklets, a how-to booklet, so that as well as having reports on the evaluation findings, there will be a simple booklet that will describe the process of how the Larkin Centre went about developing the programme and why it was successful. Okay, so in terms of lessons learned, this is a picture of one. This gives you a sense of the men involved in the programme. The jerseys are sponsored by Celtic Football Club, and as one of the incentives for attending the programme was all the men got to go to Glasgow for a home match when Celtic were playing, and those reports are quite legendary at this stage about what went on, what didn't go on. But at the end of the course, there was a match between two groups within the programme, and that was like a Champions League kind of fixture at the end. So, what were the key lessons learned? And these are some of the kind of reflections on mainly the first part of the evaluation, some on the second as well. Firstly, the interventions with clearly defined aims and outcomes are more amenable to evaluation and to demonstrating effectiveness. So one thing that the Larkin Centre did really well was to have clearly measurable, definable objectives for the programme that made it easier for us as programme evaluators to discern whether the programme had been successful or not. The second point I think is really important is all parties need to understand at the outset what's in it for me. So what we did at the start was we developed a memorandum of understanding so that the outcomes of the evaluation were clearly defined at the outset. Everyone knew what the expectations were, what each partner's commitment to the evaluation was, so that it was clear at the outset that there was no hidden agendas and that everyone was clear about what the evaluation was about. Thirdly, I think what's really important was that there was a strong theoretical basis for the interventions, and that seemed to contribute to effectiveness. So the intervention was very much grounded in a community development model, empowering the local community, respecting participants within the local community, and it adopted a social determinants approach. So it wasn't a judgmental, blaming approach to men's prior health behaviours or history of drug addictions or any other problems like that. It kind of started with a clean slate. It accepted the men as they were, took them at face value, and that really shone through, I think, in the way that the programme evolved over the 10 weeks. So that was the kind of theoretical basis to the programme. Fourthly, I think it's about evaluation beginning at programme, not just programme when the programme begins, but a programme conception. So obviously doing the evaluation we're doing now and having a match control group for the local community is not ideal. Ideally would have been to have a control group and the intervention group from the very start, and to take baseline measures and then take follow-up measures. So this is one of the things that we will feed back into the findings of our report, is to encourage future programmes to develop evaluation measures and tools from the very start or from very conception. Fifthly, socially disadvantaged men in particular are not to be treated as research subjects. What we've learned from this experience and others is that sometimes there's a great interest in socially disadvantaged men to get in there, get data, and then get out and leave and never be seen again. So it's really important to respect these men and their input to the research process, and to feed back the key findings to the men afterwards, and to do it in a very respectful way. The key words I think that sum up the programme are fun, respect, trust, safety in the sense of being in a comfortable space that you didn't feel threatened, the non-judgmental approach of the staff. It was easy and accessible, and it gave a sense of a structure and order to the men's lives. We also learned that skills-based programmes work well with men, not just the soccer and the football, but the cookery classes were really, really popular, and even the health awareness, health education sessions were very much activity-based, with little questionnaires and small activity, warm-up activities and so on, so the men weren't kind of sitting for 2 hours in a row. Dissemination of findings should account for the needs of different stakeholders. So we realised that the needs of community workers are very different to the needs, say, of GPs or other practitioners. So we're trying to disseminate findings in a way that's appropriate to the needs of different groups. And finally, and probably most importantly, the single most important reason for the success of the Men's Health and Wellbeing Program is the leadership and passion of the program manager. I'm sure Anne would be blushing if I mentioned her name here, but this is the woman who runs the program is a hugely passionate, hard-working, committed lady who's really taken the programme by the scruff of the neck and is really connected to the local community. I described earlier this, but I mean, a number of times I've walked with her from her offices to the local community centre, which is about less than half a mile. But she on the way, she engages with people in the community in a way that's quite extraordinary. She knows everybody by name. She knows their histories. She knows, it's quite incredible. And this more than anything else, I think, helped and facilitated the engagement with this so-called hard to reach group of men. So finally, some gaps and limitations. The sustainability of the programme. We talked about budgets earlier. This is nowhere near like the kind of budgets we mentioned earlier, but there is a budget involved, and at a time in Ireland certainly where there's cutbacks, particularly in the community sector, this is a challenge that needs to be addressed. And one of the issues is possibly engaging with a local football club rather than Celtic, because that's one of the key costs. A lot of the other inputs are in kind. So Pfizer do the health checks, local health practitioners and community workers do the health talks, and then the Larkin Centre staff themselves provide the programme and facilities. The utility of more established measures, social capital and self-esteem, to capture more subtle changes and shifts in attitudes, values and behaviours. What I'm trying to say here is that sometimes with very socially disadvantaged groups, these kind of established measures don't always capture more subtle changes that happen in a programme like this, in a short duration 10-week programme. And this is one of the challenges for the Larkin Centre, the programme providers, because they're under pressure to demonstrate effectiveness. They need to be seen to show how many men go on to further education programmes, how many men get into vocational type training programmes, and very often there are more fundamental changes and steps that need to happen before they can get to that point. And similarly, when we try to measure effectiveness, the fact that social capital measures may not have changed doesn't mean that the men aren't more connected to their community and that the more subtle changes haven't happened. How to reconcile different expectations and agendas. You've got programme funders, programme providers, programme participants with the right mix of evaluation tools. So that's a key question. My time is just up, so I won't go into that. And we didn't do a kind of a cost effectiveness element to the evaluation. That's something we would like to do in the future. Okay, thank you very much for your time.
Okay, we do have another question from Mr. Wayne Hartrick, and we're happy you're here, Wayne. You've got some great questions, and what you'd like Noel to answer is how many men started and completed the program?
It's been running now for about 4 years, no, 3 years, I think. And there are 2 programs a year, and they try and take on about 25 men in each program. So there's about 120 odd men who've passed through the program from about 140 that started. So the completion rate is very high. Typical dropout rates of just 1 or 2 over the 10 weeks. So it's about 120 men have passed through the program over the last 3 or 4 years.
Okay, and here's a question from Robert Blanas, and what he's asking is, how did you get the participants? Were they already drawn to the Larkin Centre for other programs or resources? Was there some kind of recruitment for this particular program?
That's a really good question. It was by word of mouth, really, and knocking on doors, and some of the staff in the Larkin Centre literally going around to where the men were, say, in the unemployment, in the social welfare, where they drew their unemployment benefit, and some other clubs. There was a darts club, for example. There was a pigeon flying club, believe it or not, in Dublin, and some other quite unusual places where these men hung out. So they literally went and they dragged the initial cohort into the program. I think not literally, but so it was very much recruitment through existing areas where men congregated, but to the point now where there's now a waiting list for the program, and they've used sort of champions from the initial programs to, put the word on the street that this has got a lot of credibility. This program. So.
Great new idea for us here in Canada to go to the pigeon flying clubs. Samantha Hartley-Fultz has a question. Was there sustainability planning included in the initiative? And has community ownership been an element? One person's commenting that, could you please get a little closer to the mic?
I'm not used to high stools in Ireland.
Thank you, Melody.
So sustainability, there wasn't an overt sustainability plan. There was a budget initially for I think 2 years to run 4 programs, and then that funding has been rolled over on a year-to-year basis. And what was the other part of the question?
Has community ownership been an element, and has that contributed to the sustainability?
Yeah, I mean, it's a community development organisation that has ownership of the programme. So in that sense, yeah, I mean, it is a programme run by this community development project, and the programme has grown and developed. I mean, some of the initial participants are now mentors and leaders for ongoing programmes. There are other elements, kind of branch out elements. For example, there's a garden project that's up and running. I showed a YouTube clip earlier of some of the men, preparing meals for the kind of awards, graduation, final day. But a lot of the produce is actually being made in the local garden, which is like a little oasis in this kind of very urban area of a large city. So I mean, it is community led and community driven, and not just by the leaders in the project now, but by mentors and team leaders that have passed through the program.
I was going to ask you, Dr. Richardson, have you been in contact with the Irish Men's Shed Association? John Avoy has got quite a program going there, which sounds like a lot of your lessons learned and a lot of your where do we go from here questions are resolved right within his organization. Yeah. It's almost like reading his mandate, looking at yours, except it's a long-term program rather than short.
You're absolutely right. The Men's Sheds organisation is still at an early stage of development, but I know John quite well. Okay. And we're meeting regularly, and we're planning, together for these kind of activities. And the Men's Sheds is at the point where it's trying to find its feet in terms of funding and trying to support a number of sheds which are springing up around the country. And it's certainly tapping into a really strong need in Ireland at the moment, with high levels of unemployment and a lot of men out of work. The Men's Sheds movement is filling a really important gap. And I think this program, you're absolutely right, has great potential to meet a need that the Men's Sheds organisation could support in conjunction with kind of the community development sector generally. Yeah.
You're working hand in glove. Good.
Yeah, certainly. Yeah.
Thank you.